Are you manufacturing the vaccine that you're developing, or you're not manufacturing it yet?
No, we're scaling up to be able to make hundreds of millions of doses of both vaccines. So that's another example of what I mean about trying to compress the time period without sacrificing safety in any way. So we're going to be prepared if the data bears out that one or both of these vaccines are useful from a safety, efficacy, from a risk-benefit standpoint. We're going to be ready to come forward with hundreds of millions of doses in fairly short order.
Well, two questions that arise if there is a vaccine is, how do you get it? What's the distribution, and how much does it cost? So how are you going to decide who gets this vaccine first? And what are you going to charge for it?
So I'm glad you raised the distribution issue, because often people are talking about the scientific conundrum of coming forward with a vaccine that works. In some ways, maybe even a harder problem is what you just put your finger on, which is distribution. So again, I say again, this is a global pandemic. It's everywhere in the world. I often say that none of us are safe until all of us are safe. So it's got to be given broadly to humanity. So we need a vaccine that we can make and distribute around the world. Now, one of the challenges on distribution, and I'll be blunt, is that we're seeing a lot of sort of nationalistic a desire to make sure that one country gets it before the other. And the challenge for us is that we believe that the vaccine should go first to certain populations. So let's say frontline health workers should get it early. People who are particularly vulnerable because of their age or because of their comorbid conditions, their other sicknesses, ought to get it next. And so the challenge for us in the first instance is to make sure that we get it to the people who need it most, but also beyond that, to make sure that we can get it to people in the US, other countries in the Western world, but very importantly, it's also got to get to people in the developing countries where they don't have the ability to pay. And Merck has a long history, frankly, of working with governments and nonprofits to make sure that our vaccines are broadly, accessibly, and affordably available.